I have the pleasure of introducing the term AI, which I wasn't looking forward to. The way that I see AI is a loose umbrella term that has been used to refer to digital technologies that bear use of varying levels of machine learning models. And on this slide, what I've done is that I've listed three typical examples. And as you can see, what Julia just said before, they're quite heterogeneous in themselves. So when discussing AI's impact on the future of organizations and professional work, what matters is to articulate the class of AI. And there are many ways to go about that, but three ways that might be helpful to people in the room are to think about the purpose of the AI. So whether it is for clinical use or whether it is for administrative and workforce management or optimization of facility maintenance, for example, within hospitals. Another way would be to look at it in terms of its autonomy, whether it augments existing work processes, such as the human together with the technology are able to achieve more or faster processes than what would have been possible otherwise, or whether it is able to substitute otherwise tasks that were performed by humans. And a third way would be to look at the scope of the AI technology. So, for example, some AI narrowly focuses on single tasks by single occupational groups versus units and across organization use. So across those, categorizing AI across those dimensions or even other dimensions that might be relevant for organizational scholars and for management scholars, that is important in order to better understand the impact of AI in organizational work. But another level to think about is more debate that has emerged around what AI is in itself. So how do digital AI tools differ to other digital tools and digital technologies? A helpful way to articulate this distinction is by highlighting those characteristics of AI digital technologies that are more accentuated in AI digital technologies as compared to other digital technologies. The first two, complexity and opacity, have been discussed by colleagues who are sitting in this room and whose work we lean on. The idea of complexity being that compared to other technologies, AI draws on neural networks that learn from large amounts of data and develop patterns over time. The idea of opacity being that those patterns are difficult for humans to understand, but what we can understand is the effect of those patterns on outcomes. So we see the outcome and we see the output of the AI, but not necessarily understand how those interact within. That's the black box idea. Learning is a key characteristic of AI because it offers a nice distinction to other digital technologies that might be primarily frozen in specific versions, versus AI's ability to evolve and do that on its own over time without human intervention sometimes. That is something that we can handle as a distinguishing characteristic. The fourth one, distributedness, is a characteristic that came up very strongly in research that Julia and I have ongoing with open source AI currently. The idea that the sourcing of elements of AI, from training to the models themselves and to the data, is spread across multiple organizations in a way that is different to the traditional pipeline of development and implementation of other digital technologies. So where other digital technologies might well be contained within a single organization in their development, or might be developed by a group of organizations that have specific contractual relationships to each other, what we see with AI is that different elements of it are distributed across organizations, and it wouldn't be able to reach its potential without that distributedness. That is the difference there. So having a look at those distinguishing characteristics and many more or other that might come up in your own research or through the discussion with the panel today, what becomes important is to be able to articulate the characteristics of what we see as AI digital technologies and how those make an impact on the future of the organizations. And that generates more questions than answers. And those are questions that we have in our own research. So Natalia and Julia and I were motivated to have this PDW in the first place because we are in the middle of dealing with these questions. And we do look forward to your answers, by the way, or some answers even more from the audience. What our studies that are ongoing are in the field of healthcare. And the questions that have come up from the audience, remember, we did ask you to contribute your questions before this PDW would start. These questions for us are questions that can propel forward this field of research if we start grappling with them. For the first question on the division of work between humans and machines, for example, from the study that Natalia has undertaken with Hila and Sarah, what has been shown is that the initial inclination that professionals had was that they were happy to give up routine tasks, the bone age, for example. But what happened afterwards was that it turned out that a lot of professional know-how was used for that seemingly routine task. So perhaps we cannot say a priori which tasks are routine and which tasks are considered to be easy, but instead what we should do is have pilots to understand that in practice. For our own research with one of our ongoing studies with Julia, what we found with Professor Bart van Este, who is in this room with us today, what we are empirically investigating right now is why different occupational groups agree or disagree with the AI's output on the same patient's care. So what we compare is the responses of staff who are consultants, experts, highly trained, to staff who are not so trained and not at the consultant level. And what we are aiming is to map the boundaries of AI opacity for different occupational groups in different organizations. So for the second question that came from the audience, which focuses on the motivation of clinicians to accept and trust AI systems, Natalia's study with her collaborators has shown that there were big variations across even 3 radiology departments. And what they learned was that the tool was most useful in one radiology department, but at the same time, it wasn't used much or perceived as useful in other hospitals and in other units. So can we generalize, and how do we generalize? And some tools that seem to be useful short-term because there's some excitement around them and some motivation by the leadership or the department might not necessarily be embraced long-term, and they might even become an obstacle in practice in the long term. And similarly, what our cancer AI study showed is that AI characteristics might become obstacles in the long term if the use of them evolves beyond the boundaries of the department where they emerged initially. So these are the questions that we are very fortunate we will direct to our panel, and they will talk to us about their own experience and their understanding and where they think these questions should take us next. I will briefly introduce to you how the rest of the time together is going to play out. Our panelists will each take a question and address those questions that have been sourced by the audience, by you. Following that, we will have separate roundtables. We will need to be a little bit inventive with the roundtables. We asked for 5, we got 2. I guess that's a good start. The rest of us will have to huddle around, sort of. And that will take us until the end of the day, when we will be very, very looking forward to hearing Natalia's conclusion of the day and takeaway messages. So do stay until the end. I think that will round up our day nicely for the rest of the structure for today. So I'm going to hand over to you, Julia.